And look at these athletes. I mean, they live such a healthy lifestyle and exercise and everything else. And again, cancer has no prejudice. So
I mean, and this is just a few. We got Mario Lemieux. We got James Conner, Brian Boyle, Eddie Olczyk. I mean, these are just a few. I mean, Lance Armstrong,
amongst other
hundreds.
thousands of athletes.
I got bones. I got bones. I got bones. I got bones. I got.
Welcome back, everyone. 2019. Happy New Year. This is another session, and today I have with me Dr. Elwyn Kabebe. He is a superstar here in the Bay Area in knowing blood clots and blood cancer, everything blood. Is that correct?
And cancer, yes.
And cancer, of course.
I don't know if I know everything, but yeah.
Well, you know a lot more than me and a lot more than my audience, and this is why I wanted to have you on with us. We have some superstars in many sports that are battling cancer, that have had cancer, and that are just continuing to deal with one of the toughest diseases known to man. And that's why we have experts like Dr. Kabebe here, because this is not something I understand very well, but it affects the athletes that I enjoy watching, that we all enjoy watching, you know, and it's tough. I mean, we've seen people like Mario Lemieux, superstar, get diagnosed with Hodgkin's disease, which we'll get into, and then come back like as a super athlete. And so let's start. Dr. Kabebe, tell me about Mario Lemieux, first of all. You know, this is a guy that got diagnosed with Hodgkin's disease, which in 1990, in the 90s, 92, I believe, December 92, when he got diagnosed, no one really knew, what is Hodgkin's disease? I was in med school at the time. I was learning about it. So tell me what it is and how he came back with this cancer.
Yeah, it's a tremendous story, Mario Lemieux's story, in terms of his resilience. I think the first thing to really emphasize is that, you know, cancer has no prejudice. I mean, you could be young, rich, poor, an athlete, or or just a normal person throughout the day, and you get cancer. And a lot of times, unfortunately, we really don't know why these things happen. And you know, there are various types of cancers. His type of cancer was a cancer called a lymphoma. And lymphoma are cancers of lymph glands. There are lymph glands throughout the entire body, from the top of your head and down to your toes. And these organs really help to kind of fight the infections that you develop in your body. So if you get a chest cold or you get an upper respiratory infection, you'll notice some lymph nodes that are somewhat enlarged in your neck. That's your immune system and the immune cells that are in those lymph nodes trying to fight the disease. And then they come back down to normal.
So lymph nodes, okay, so just to clarify, so when people feel the lumps in your neck, when you get a cold, you feel the lumps in your neck on the sides, right? That's what we're talking about?
Correct.
But they're also under the armpit. Yep. Like for breast cancer, oftentimes it's the axillary nodes that are affected.
Absolutely.
And then you've got lymph nodes all along the chest, into the gut, the mesenteric lymph nodes, like colon cancer. For example, we have Eddie Olczyk, you know, recently struggled with colon cancer. And so the venous system connects to a lymph system that drains back into the vena cava, which then transports to the heart, which gets filtered through the body, right? That's a very simplistic way of describing it, but it's kind of like our body's immune filtration system. Is that right?
I guess you could say it's like highway of different immune cells sort of circulating, like little police that go around trying to find different ways to combat infections and get you better. And unfortunately, as every cell in the body has a certain sort of division process, they grow and divide and they die. So these cells are also susceptible to kind of uncontrolled division. And this uncontrolled division is really what develops into these cancers, is that somehow the mechanisms have gone awry, and then these cells continue to divide uncontrollably. And as they divide uncontrollably, then they cause harm. And so in Mario Lemieux's situation, you know, he had multiple lymph nodes that were involved with this cancer and were overriding his system, that were causing him to have symptoms and needed therapy for that.
Mm-hmm. So before we get into therapy, I mean, you know, Mario Lemieux is just an incredible superstar. I mean, you know, like just seeing him come back from what he came back in. I mean, it is an incredible story, but so you get these lymph cells, and they travel everywhere, And I understand, again, trying to keep it simple, even for me, is that either they get overexcited, overpopulated, or there's like a signal that's lost to prevent them or control them from growing.
Yeah.
But what is it about the cell itself? Is it deranged? Is it deformed? Is it just a normal cell that's hyperpopulated?
Yeah.
It's genetic signaling. Is it environmental? I mean, I understand it's multifactorial. I mean, we don't know what causes it. Is that right?
That's correct. I get that question every day as an oncologist is how did I develop this disease and why? And what could I have done to prevent it? And unfortunately, many times we really don't know what that smoking gun is that encouraged this process to develop.
Mm-hmm.
You know, we know that there are certain genetic susceptibilities and then there are certain environmental exposures. And sometimes it's kind of a combination of those two things that align that cause the alteration that makes these cancers continue to divide uncontrollably. So, you know, it's a hard thing. I mean, there are different postulations in terms of what, how cancer develops, whether it's an infection or chronic inflammation, certain sort of genetic drivers as well. But unfortunately, we really don't know, and many times we don't.
So, I mean, small cell lung cancer, for example, like lung cancer, tobacco, like you smoke in, you get carcinogens, and then you get lung cancer. I mean, that's one almost direct causal factor. Is there something like that? So there's nothing like that in leukemia or lymphoma that we're aware of?
Unfortunately, there are a lot of kind of suggestions of certain lifestyle or environmental exposures or even genetic risk factors for this type of cancers, but it's not once again answer. I think. Unfortunately, you can't say, okay, you should alleviate dairy from your diet and you will never get cancer. That's just not possible. Unfortunately, there's so many different mechanisms that cancer sort of that makes cancer develop. You know, you can have a bad infection and that can develop into cancer. You could be exposed to smoke all your life because your parents were smokers, and that can develop into cancer as well.
Or foods, or I mean, I know there's
so many different
we always talk about healthy eating and nitrates, but it's so many factors. Because we all know someone who eats everything or smokes everything and they're perfectly healthy.
Yeah, I mean, look at these athletes. I mean, they live such a healthy lifestyle and exercise and everything else. And again, cancer has no prejudice. So
I mean, and this is just a few. We got Mario Lemieux, we got James Conner, Brian Boyle, Eddie Olczyk. I mean, these are just a few. I mean, Lance Armstrong.
Amongst other
hundreds.
thousands of athletes.
Yeah, and well-known athletes. And then you'll talk about a lot of athletes, or in a sense, we're all athletes in this world. We're all struggling with something,
Very
right?
much so.
And these are super athletes because they're on the media and the news. And so it's just to make it easier, like, why don't we start with Mario Lemieux? Let's talk about him, what he went through, and get into the treatment. Because how did this guy from December 92 diagnosis on or about, and then come back in a year and a half later? It was the night that he had his last radiation treatment. He came back and played. How did he do that?
I think he scored too.
Yes, and he got points and an assist. How did he do that?
Well, you know, I think the common thread that we see with most athletes is that they're constantly challenged, right? Their lives are always about being challenged to get to that next level. And I think that path to of resilience and has led to their greatness. And I think that's a consistent theme, as you see with all these individuals that we just spoke with, amongst others as well. And I think when you look at them going through cancer treatments, I think in a similar vein, they almost follow that same pathway, you know, in terms of being pressured and just having that mindset of just, you know, pushing through the pain, getting to that next step, that next goal. You know, my son plays for midi basketball, and his coaches always talk to them about, okay, next play, and I think I keep that in mind when I think about talking about these athletes. It's just, they're sort of just, you know, moving forward. And you look at James Conner and his ability to work out while he's going through chemotherapy. I mean, that's just
incredible,
tremendous. It just shows such a strength, and I think that's really what's really drives these athletes is that, you know, they're just used to being under the pressure and working through that and just taking whatever cards they're dealt with and making the best with it and just keeping their mind on the prize.
Like, I like to think about just exactly how you're saying. I love this, and I'm going to just interrupt you for a moment, because for me, I've always thought of it as tenacity and grit. Because aside from the cancer diagnosis, I mean, there's actually a book called Grit. It's a great book. It's worth reading. I'm not promoting it in any manner, but it's worth reading. But tenacity and grit, these athletes have that. So you're talking about not just someone who's physically above average. You're talking someone who's mentally tough above average. Like they've had to come from up the lower ranks from a kid all the way up to superstardom. So in order to do that, they're physically and mentally tough. And then you throw them the toughest disease known to man.
Yeah.
So if anyone's going to survive, and they're young, right? Youth has an advantage.
Yeah, definitely. I mean, in general, the cancers we talk about, say lymphoma or testicular cancer, say with Lance Armstrong and others, you know, those diseases tend to have what we call a bimodal distribution. They tend to develop earlier in ages, like the 20s and 30s, and then there's a second sort of peak in the later age. And we know that age in and of itself is a better prognostic, or better factor for patients who are diagnosed with cancer. The younger they are, the more resilient they are, the more they're able to withstand a lot of the stressors that chemotherapy has to your body. I mean, unfortunately, in the job that I do, at times we have to provide them, we almost have to make them sicker in order to get better, and just to be able to have the, you know, as being a young person, and again, with the same sort of mindset that these athletes have, allows them to really succeed in these circumstances. So, it's pretty amazing.
Yeah.
You know, interestingly, you know, I always think to myself that adrenaline is an actual natural analgesic. So it actually makes pain less by having so much adrenaline. And I think to myself, well, I'm not an athlete, but many of these athletes are always have constant adrenaline going that, you know, they kind of numb out a lot of that sort of pain. And I don't know if that's somewhat very similar as going through the process, going through chemotherapy with the nausea and the fatigue and all the different side effects that the therapy does give them. So
yeah, so let's talk about some of this therapy. So there's radiation, which is essentially really bad X-rays, like high dose, and then there's drugs. I mean, these are some of the toughest drugs that we can make. They kill cells. Yeah. So tell me about. Well, Mario Lemieux, he had radiation treatment and chemo. So let's start with radiation, or tell me about radiation and chemo.
Yeah, you know, I think, so first off, when cancer cells are constantly dividing, and so what you want to do is you want to give therapies that inhibit the division process, that dividing process. And chemotherapy, radiation are ways to inhibit the division process. Radiation basically damages the DNA of the cell, and it stops the DNA from replicating, and thus the cancer cell stops dividing. And also it's somewhat of a kind of burns the cell, right, in that sense, because it is radiation. Chemotherapy is a chemical, and it's a chemical that goes in the blood system, and it goes wherever the cancer cells are, as well as where the cancers that we see, like on a scan or on lab work, for instance, and also goes to cancer cells that we don't see. As you know, a lot of times there are microscopic cells in the body that harbor the cancer cells that we're not able to see. But what's nice about chemotherapy, it goes what we call systemically. It goes in the blood system, goes everywhere. And what it does, depending on what type of chemotherapy it does, it sort of follows the same treatment plan, which is to inhibit the division process of the cell, the cancer cell itself, and stop that division process. Now, unfortunately, there are normal cells in the body that are constantly dividing, you know, things like your hair follicles, or the white blood cells that fight infections, your red blood cells that provide oxygen and nutrients to the rest of your body.
So that's why people lose their hair.
That's correct. The lining of your gut, for instance. So and that's what causes nausea for patients sometimes, and the fatigue that comes with all of that. So, no, those are all bystanders of normal cell processes that are inhibited by this treatment with chemotherapy.
And the fatigue is from, aside from many factors, but from the blood cells too, right? They're dividing, so you get less oxygenation, less movement of healthy red blood cells, and so you get fatigue as well. So, and this is just fatigue, nausea, and hair loss,
nausea, fatigue, risk for infections, risk for anemias, risk for bleeding disorders. There are certain side effects specific to chemotherapy, like neuropathy, numbness, tingling in hands and feet, which you're very familiar with orthopedics and all. Yeah,
So the list
it can
is
heart-
numerous for what it
heart
could do.
function, disorders, liver abnormalities. I mean, there's just a whole host. Diarrhea
Right.
can also be that. But like I said, these athletes find ways to persevere. It's amazing.
Yeah. So if we were to look at one of these chemotherapy drugs, we would see probably pages and pages of side effects.
Yeah.
But I mean, you look at cancer,
Yeah.
and cancer causes death,
Yeah, that's the
and
sentiment.
drugs cause side effects
Yeah.
to counter death.
Yeah.
So you always have to balance that benefit risk.
Yeah.
And right now, as far as we know, these chemotherapeutic radiation treatments on the benefit risk scale, if you talk about the risk of death versus the benefit, even with the side effects, is still higher than the risks associated with them. Is that correct?
Yeah, that's a great question. That's a challenge for me as an oncologist every day, is deciding where that risk-benefit ratio is, providing that to the patient, and then quite frankly, it's really their choice. I mean, we're not in their shoes. They have to have the wherewithal to be able to withstand the treatments, but they also have to understand what they want to endure and what they're willing to endure. Mm-hmm. And so, there are different factors that go into recommending a certain therapy to the patients. There's specifically for us as oncologists, we look at something called a performance status, how functional they are, how symptomatic they are from the disease, what other end organ or other comorbidities that they have that may limit our ability to provide, adequate amount of treatments in order to decide whether or not the treatment is feasible or reasonable, and then kind of guiding them about what we think is best for them, But certainly a lot of these young athletes are very healthy, really no other medical problems, obviously,
Right.
and so it's very hard to not want to offer the most aggressive therapies,
Right.
but even for athletes, for anybody,
It's
it's tough.
Yeah.
And so, but fortunately for testicular and certain types of lymphomas, like Hodgkin's lymphomas, like that affected many of these athletes, their prognosis is very good, even if they had advanced disease, even with the aggressive therapies that we have out there. In addition, now with the newer therapies that are being developed for cancer treatments, so I did my training at Stanford, and amongst all the different cancers, Hodgkin's and non-Hodgkin's lymphoma was probably pioneers of Hodgkin's therapy, and the newer therapies are really developed here at Stanford University that there's a whole realm of targeted and immunotherapy trials that are out there that allow less toxicities for the patient, but maybe even better outcomes for these patients than standard chemotherapies. So we don't always have to say patients have to suffer
Right.
in order to get better.
Right.
That I think we're hoping moving into a new era where the landscape of options are much more bountiful,
Right.
in addition to the fact that the therapies are much more, promising and less
Patient-friendly.
side effects.
Yeah, which is a great point, actually, because when it comes down to new drugs, new therapies in the biotechnology regulatory space, we're talking about a patient-centric focus. So it's about the patient-reported outcomes. It's about a caregiver-centric approach. So it's a combined decision-making approach. But then when you talk about these drugs, especially through the FDA, through these clinical trials, there's value-based judgments, and these are based on the patient and the physician, as well as the regulatory agencies have to make some type of judgment. Now, for them, they have to remain fairly agnostic because they have to look at what is the data. So they focus on the data, and so a lot of companies are presenting patient value-based, physician value-based judgments. Was this a valuable treatment? So having patients go through this, even though it can be difficult and some drugs may not get approved, but they still have some benefit, and for the most part, thankfully, we have some very good therapeutics out there for patients, but they've gone through a process where as physicians, as clinicians who take the Hippocratic Oath to do no harm, in this case, in the grand scheme of things, the value-based judgment for the benefit is still no harm in the grand scheme of things,
Right.
even though there is some harm to the patient.
Yeah. I mean, like I said, you sometimes have to make them worse in order to get better, but the hopes are that that the efficacy is worth it.
Mm-hmm.
The outcomes of having this go away and never come back, and their overall survivability is worth the grind, I guess
Right.
you could say, of going through these few months or many months of chemo, radiation surgery,
Sure.
whatever it may be, you know. And you're right. I mean, medical economics, we can hold to a whole new talk about that. I mean, these drugs are extremely expensive. It takes, you know, what, like $1 billion to get a drug from lab all the way to market, you know,
Right.
and everything, all the costs that come with it all. But, you know, I look at it from the science standpoint that there's some really amazing successes in terms of therapeutics out there.
So if we look at these therapeutics, and then let's start with Mary Lemieux and Lance Armstrong and James Conner, and let's look at it. How do they come back so strong? I mean, they're super athletes, they get beat down, and then once the cancer is gone, hopefully,
Yeah.
they just bounce back. Now, is there a component of drug benefits, steroids that they received? I mean, how did Lance do what he did and come back, aside from any other steroids he may have taken? Same with Mario Lemieux. I mean, he came back and he was not using anabolic steroids.
Yeah.
I mean, these athletes, for the most part, bounce back. How do they do it?
Yeah. I mean, well, how does anybody do it? Like, comes back from such a harrowing sort of experience, you know. Again, I think a lot of it has to do with that self-resilience, you know. I think whether you're an athlete or whether you're just a regular Joe, you know, you just kind of find that fire within you in order to battle, you know, to kind of redefine your normal. That's what I usually tell patients. It's kind of, you're never going to be the same person that you were before. You have to kind of redefine your own story, redefine your new normal. And it takes time to find out when that actually happens. So in terms of oncology rehabilitation, I mean, that in and of itself is it's a field I wish we'd had more research in. I think there was more development in, because as you can tell that, especially these athletes who are dependent on getting back to that stature, that they really need you know, some guidance about what that map looks like, you know, and working with the toxicities that have come from their treatments. And, you know, it takes time. I tell patients, like, it takes maybe up to 6 months to feel maybe 80 or 90% of what you felt before you start your treatment. And it's a matter of going through physical therapy, you know, whether it be occupational therapy, sometimes speech rehab, depending on the circumstances, you know, talking about nutrition, you know, what kind of foods that are really beneficial for you, how much to push your activity level. I know a lot of patients want to go back and start running their, you know, 5Ks, you know, the day after chemotherapy, because that's what they did before. But really telling them to pull back and say, look, you need to start off a little slow and escalate a little bit, day by day, week by week, you know, in order to get back to that same level. And quite frankly, just being patient with yourself. And I always tell patients, you have to forgive yourself. You can't keep saying that, you know, oh, I'm not getting to this time point, or I'm not getting to this rep count at this stage. You have to forgive yourself. You know, you've been through the worst thing of your entire life, and you should realize that going through that and battling that and getting to this point is a triumph in and of itself. And that given that you can do that, you can get back to that stature that you want. But again, it's a lot of it is, it's just perception and the survivorship plan that the oncologist provides in terms of, like, you know, follow-up scans and lab work and how many visits that you need, and any additional treatments after that. That also needs to be the forefront of your rehabilitation as well. So yeah, it's a complex sort of thing, case by case, depending on what cancer they had and what kind of treatments they have. But as you can tell, it's doable.
Yeah, it's remarkable how these people have come back, and you know, you probably have one of the toughest jobs. I mean, telling people they have cancer and then treating it. Can you tell me what's your toughest moment, if you can? I mean, I'm sure you have a lot of tough moments. What's the toughest moment, based on a scenario you can describe, that you've had to deal with a patient?
I mean, you know, when I was going through med school, my wife asked, and I told my wife I wanted to be an oncologist. I think she was wondering, why would you want to do something so sad? You know, I don't want you to be sad all the time from it all. And I think my perspective on oncology was a lot different. You know, I see it as you as an oncologist have this opportunity to be able to make the worst situation that this person have that this person's going through and make it the best that it can possibly be. And you're probably in a situation where you're really helping them when they most need a physician or need a clinician at the most. And I think although a majority of my time is talking about sad cases and not everyone survives, a large majority of my time patients are cured of their disease. And so I think one of the joys I really receive of being an oncologist is being able to kind of follow these cured patients or people going in remission and kind of asking them, so half of my time is about their clinical issues and then half the time is, so did you spend more time with your children today? Or how much exercise are you doing? Are you still back to that same lifestyle of, the grind? How has your life kind of changed? How's the lens of your life changed since this diagnosis? It's almost like an awakening. And to be able to partner with patients, being there through that journey, and then now following them in terms of their new life and this new horizon that they have of their world, is pretty special. Really special to be a part of that space. So it is challenging. I mean, every door that I touch before going into a patient room, I do a reset. I kind of say, okay, whatever happened to the last patient, I can't bring this into this patient because I keep going from bad news to good news to bad news to good news, back and forth throughout the day. Every situation, I'm in their sacred space, and this is their journey, and let's be present to that. So it's tough, especially when the young patients don't do very well, or they're having so many toxicities. I kind of wonder, well, is it worth it? And the people are just amazing. They just want to keep fighting and keep going, and it's and you want to be there for them, but you also want to make sure that their quality of life is really the best that it can possibly be. So I guess the long answer to that question is really just, I think we're really fortunate to be able to take care of people when they really need you the most. And again, cancer medicine is just evolving, and there's just amazing drugs that are developed out, targeted treatments, immunotherapies, CAR T-cell therapy, which are other types of treatments for lymphomas and leukemias that are coming on the horizon, which are allowing people to live longer, but with the best quality of life possible in that time. So.
That makes so much sense. It's so nice to hear that. And it's also nice to hear sort of that human compassion, that element that sometimes gets lost as physicians, the white coat phenomenon, where sometimes patients feel like they're going in and they're just being told, they're just doing lab work, just getting treatments. But I can see that you love what you do, that human compassion, that element. It's hard to place that, and that's so important, especially in the field that you're in, but in any field as physicians. People want to relate to someone. They want to feel like they are loved as a holistic individual, like from a medical, social component, because they're suffering. And I think it's great that you brought that up. It's amazing seeing that passion come out in you, and you're definitely the half full kind of guy, and I love that. I love that. So that's so important.
Yeah. Hopefully it's all similar to what you do too. I mean, you're holistic. An elbow pain is not just an elbow pain; it's all connected somehow. And kind of looking at it from a general, a quality of life perspective, you're trying to improve their quality of life. I mean, I think anybody that wears a white coat like we do and tries to taking care of people, it's all about those goals for them. And the cards are dealt the way they are sometimes in life.
That's true.
And
absolutely.
You've got to do the best you can with them, and so I call myself, we're all instruments in a bigger picture of things,
That's right. So, I use a scalpel, you use a prescription.
I'm good with drugs.
Yeah, you're good with drugs, I'm good with the knife, Well, this is great. Thank you so much,
you're welcome.
Dr. Kabebe.
Thank you so much for having me.
I know it's
very complex. We could go on and on about all the different individuals and what they went through and their different specific treatments, but I think we got a general sense of kind of cancer treatments in these.
Absolutely. So that was a brilliant discussion with Dr. Kabebe, and we have the NHL All-Star coming up. We've got the NFL Pro Bowl. This is all about some of these super athletes that have battled cancer, and I just feel like it was my privilege to just have this opportunity to discuss this and share with you that, hey, we're all feeling this. We're all feeling how tough it is for the bones, the joints, the entire human body and psyche to go through some of this mental toughness and resilience. I mean, these are super highly resilient people that have come back, and we're going to get to watch them. And we've watched them from cancer to superstardom, from all-stars to suffering and back. I mean, this is an opportunity that we can all just take a moment and just reflect on who we are and who these people are, and just say, thank goodness, and bless what we have. So thank you again. I'll see you soon.
I got bones.